name's Kirsty Dawson. I'm a doctor, I'm a GP, better known as a general practitioner. I was asked to do this video to give you a bit of a flavour of what life as a GP involves and how to get there. So for me, for doctors, after studying A-levels, go off to university, and most of us have done a 5 to 6 year degree at university. Most medical schools require candidates to have done some sort of science A-level at some stage, but each university differs slightly. After university, all doctors, no matter what specialty you end up going into, do 2 foundation years of training, which is at a hospital. And then after that, you end up going to the training scheme of the specialty that you choose. So for me, I did general practitioner training, which is 3 years. Other specialties is, that the years of training vary from specialty to specialty. So being a GP, what's that all about? We have quite an important role in looking after patients within their homes and within their communities. We're often the first port of call for patients presenting with a new physical or mental complaint. We often become the face of medicine for lots of patients, and we end up being the people that they know best of all. So GP appointments generally last between 10 and 12 minutes, and it's not often a very long time to make a full assessment of a patient, especially if there's someone that's not known to you. And so communication skills are often a key part of our role, a key skill for us, and something that we focus on quite a lot. We obviously see patients from different cultural, spiritual, religious backgrounds, as well as people from all age groups. So we see newborn babies and we see elderly patients, and it's about being able to communicate with people from this sort of wide range really, and finding out information that's important to them and it's important to you in terms of making a diagnosis or deciding whether they need further investigations or not. Seeing GPs by themselves in an office can often seem like that might be quite a lonely profession, but actually we work within a wide range of healthcare professionals who, as a team, we look into the kind of whole of a person. So, their mobility, their health, their mental health, what medicines they're on. And so actually we work within a really big team of people, and that's quite nice. It gives you the sense of that working within a team. You get to know lots of colleagues, and it's quite a nice supportive environment. So apart from just sort of diagnosing patients who come in with problems, a big role of ours is promoting health, so keeping people in the community as healthy as they can be, so trying to stop them becoming ill in the first place. And that's often involves educating people about health and trying to empower people to take care of their own health, so that hopefully they need to come and see you less, and hopefully have less health problems in the future. Another big part of our role is looking after chronic health problems such as like diabetes and asthma, heart disease, and that's a big role of ours. But we also do see acutely ill patients, and those are the ones that are important to spot because they often need something doing immediately, and it's being able to pick out of the, say, 30-40 patients that you see in a day, which are the ill ones, who are the poorly people that need to go straight up into the hospital. And often it's a part of pattern recognition of being a doctor, so you learn to recognise what signs and symptoms mean what, and as I say, which patients need more investigations. One of the good things about being a GP is that it can open up quite a wide range of career paths even within the specialty of GP. So lots of GPs enjoy teaching as part of their day-to-day work, so we have medical students or trainee GPs sitting in with us, so we do lots of teaching. There's also the opportunity to have a special interest, so you could be a GP that's got a special interest in skin, so you sort of do your GP role as well as being a skin specialist on the side. Lots of people also do some minor surgeries, have an interest in sort of sexual health, and so end up doing lots of women's health and things like that. So really a GP, it's a very broad interest in medicine, but you can also have a kind of specialist interest as well. I guess the other good thing about being a GP is that at some point, if you wanted to be, you could become a GP partner, which means that you're essentially running a business or involved in running a business, and so people who've got interests in that might find that something that they want to prioritise.